Hi, this is Dr. David answering questions that are coming in terms of safety and procedures when it comes to going back to school. First question that was asked is it safe for my child to wear a mask? I know that this is something that has come up for a lot of people in terms of the safety. For those of us in the medical profession, we have seen no evidence of this. Obviously, as a physician, I've worn masks for many hours back in my days at Tampa General, in the ICUs and in surgeries and deliveries. Doctors have obviously worn these things all the time. We have seen no evidence that for the overwhelming majority of people that there are dangers wearing the masks. The one exception that I have come across was a patient who had previous and ongoing lung damage, and her oxygen levels were running borderline towards a low normal in the first place. Oxygen levels could go down a couple points, but not to a significant amount in most people. But this particular individual, her levels did go down in under 90%, which is kind of the cutoff for when we start to get concerned. Real dangers for oxygen levels is lower than that. But one of the things that we did in our office is Patsy, Ethan, and I, we individually took a pulse ox reading and an oxygen reading with ourselves not wearing a mask first, and then we put the mask on in different types of masks actually. And a few minutes later, about 5 minutes later, we started recording our oxygen levels again. And while we each saw a drop again of maybe 1 point, 2 points, I think someone had none. No one went even close to having low levels. So as long as the person has normal functioning lungs, I don't see where this would be an issue. Another thing people have raised is the elevation of carbon dioxide levels. Certainly, another point or two of carbon dioxide could go up. But we also have buffering systems. So if we have proper functioning lungs and we have proper functioning kidneys, our bodies have a great way of getting pH back to normal if there's a little bit of extra carbon dioxide level. Our bodies are totally okay to handle that. And if you look at the safety values, we still wouldn't be coming close to where there's an issue. Then there was also the question about, could it be making the virus worse? Are you breathing it back in? And this is the one that I'm having one of the bigger challenges with, because if it's inside you already, it's inside you already. And you're not breathing any significant back in relative to something that just hit your mask, is kind of stuck there. Again, a particle, whether it's an aerosol, is going to hit something that's like a mask, and it's going to stick with that. Kind of like when you put water into a paper towel, it doesn't bounce back up on you, it absorbs it. So I really don't see how that would be making it any worse, especially again compared to if a person has it in their body already, in their lungs. It's already there. So I hope that helps explain that. Thank you.